Hi, my name is Michael Fleming from the Alchem Group. We're based here in Cork and in Bahrain. We provide mainly safety solutions for clients both here and abroad. Currently, what we're doing at the moment is we're helping companies and our clients to get reopened for business again following the lockdown and COVID. So as you prepare to reopen the business, you must plan for it. So the government want us to have a plan in place so that we know what we're doing and we can preempt things that may arise, like infections, etc. There are a number of steps involved in reopening the business, and I'm going to go into these steps later on in the video. But the first thing and the main thing that you need to do is you need to develop what's called a business response plan for COVID-19. So you want to open and you want to stay open. The HSA are the ones that are being given the task of inspecting businesses, and they and the government have said that if you're not compliant, that they will close the businesses. So Alchem can produce your business response plan for you, and this is going to include all the risk assessments. I'll talk about it later in the video. You will get a complete and detailed checklist of what you need to do before you reopen the business. So with this, what I want to do is put it in plain English, what you need to do to be compliant with the guidelines that they've set out. So the first thing to talk about, there's a few things that people are unsure about, and would be the use of masks. So as you know, we have to have social distancing within the business. So that's people 2 meters apart. So where that's not possible, if you can't have somebody within 2 meters apart, well then masks have to be worn. I'll give you an example, like in a restaurant, in a deli. If they can't be 2 meters apart, well then masks should be worn. Okay. The second thing is people are talking about temperature. Do we need to temperature record people as they come into our business? The answer is the HSE. They don't have any recommendation for that for ordinary businesses. Now, however, they do state that in circumstances like in the healthcare industry, that people would be temperature checked to see if they're showing any signs of having COVID. So to plan for opening up, the government have produced the protocol to help us to do that. So I just want to outline it in layman's terms what's going to be required to do this. So there's a number of steps involved. So the first step that's required, you need a plan. So it's called a business COVID-19 response plan. So we have to develop this. It's a written document. So in it, it's quite in depth. So in it, there's going to be your risk assessments. So you're going to look at each area of the business and you're going to do a risk assessment on each area just to see what you need to do to protect the staff, to protect the visitors, customers, etc. to your business. And then you'll decide on what the precautions or the controls that you'll take for those areas. The levels of risk associated with COVID to the public, customers and co-workers. It's going to look at individuals, in your business, at-risk people, what you must do. If some of your staff have underlying conditions, well, you got to make special precautions. You got to take special precautions for them. What you would do, it'll outline what you would do in the case of a suspected outbreak of COVID-19 in your business. So really, the way to do it is to prepare this plan, and then have the workers, the staff, look at the plan. If they have something to say, if they have something to add to it, if they can help, if they've got suggestions, well, we'll take all that in place. Because the main thing here, is protecting the staff and visitors. We don't want to get an outbreak or a case of COVID in the business, because if that happens, then you're going to have inspections, and you don't want the authorities to place any enforcements on you, etc. Okay, inside the plan you're going to need procedures for identifying people who may have COVID, and what you're going to do once you do discover that they have a case of COVID-19. as staff return to work, they're going to fill out 3 days in advance a questionnaire, medical questionnaire. So that needs to be in the plan. Everybody that comes into the business will fill out a questionnaire form, so we know when they come into the business. They've answered questions, medical questions regarding COVID-19. So, like down the line, if there are cases, it'll make it much easier for contact tracing. Inside the plan, like there has to be instructions for staff to follow if they do develop signs, when they should isolate, if we should have isolation rooms inside in our business. Not all our businesses are big enough to have these rooms. So what do? We need a plan. When we should send staff home, so that has to be in there. What staff need to do if they have signs, basically. Like everything we do has to be communicated to the staff, which is very important. So there's going to be changes, and they have to be in agreement with them. So you're going to have to review and revise existing sick leave policies, for example. You have to make available the necessary public health advice from the HSE. We have to appoint a lead worker that's going to liaise with the staff, and that's usually like the safety rep. It could be the employee safety rep. That's probably the usual one, or a manager. Agrees. Then you'll agree through negotiation with any changes in work patterns, staggered lunch breaks, to the canteen. So these type of things all have to be outlined inside in the plan, so that there's a clear identification. Like this plan, it's going to be a live document. It's going to change from time to time as the government bring in new guidelines. We'll change the plan. As we discover things are working, things aren't working in the business as regards social distancing. We'll have to change the plan. Okay, so it's a live document. So once you've got the plan developed, the authorities that will inspect them and make sure that it's done correctly are the Health and Safety Authority. They're the ones that are charged with ensuring that you've got your business set up correctly for COVID, and that you've got your business response plan in place and that it's correct. If you're a nursing home or healthcare, it'd probably be HIQA. And also, like in the food industry, the environmental health officers will have a look at it. So the next step, before you open up the business and before you get back to work, is you must implement the control measures that you've identified in the business response plan. So some of those controls are going to be obviously signage, hygiene, social distancing. The staff, before they come back to work, must sign their pre-return to work form, and that must be done at least 3 days before they come back to work. All the staff must get induction training before they start in back to work. In the plan, you're going to have checklists to make sure that you've got everything covered. You're going to have to have in there what they're going to have to do if, let's say, they get COVID, and what they have to do before they come back to work again. When they must isolate, when they must stay out of work, that they must contact a GP. It's all going to be listed in there. Like if it happens that you do end up having a case of COVID, or a suspected case of COVID in the workplace, inside in your business response plan, you're going to have a response structure. You're going to have a manager appointed that's going to deal with it. Somebody's going to have to take responsibility. There'll be if you have the room, you'll have an isolation room. You call a doctor. What if somebody's too unwell to go home that day? What do you do? Do you transport them home? Do you call an ambulance? It goes down to how you clean the room afterwards, after dealing with the person that has been suspected of having COVID. So all these measures must be in the plan. In your plan, you'll have information on at-risk workers. So maybe some of your staff might have underlying issues. What do you do in those cases? How do you separate them from the rest of the staff if they are working, to protect them? It's going to deal with cleaning. What is to be cleaned. Obviously, cleaning is going to be a huge part of it, and sanitization is going to be a huge part of this going forward. So cleaning schedules, records of cleaning, what you'll be doing, that'll all be itemized in the plan. Use of PPE, when we're going to be using PPE, masks, I've dealt with it before, you know, shields, visors, etc. That'll all be dealt with. You have to identify all that in the plan. So if one of the staff members gets contracts COVID, there's no duty on you, like, to inform the Health and Safety Authority of this. The duty will be on the medical practitioner to report it. So, like I said, this document is going to be widely available to the staff and to the authorities when they come in. So, like, inside there, you're going to have information that's going to be of benefit to the staff regarding their mental health and well-being. First aid will be dealt with in there, what your policies and that are. So now you've got your business response plan in place. You've got all your controls set up. You've got your signage up. You've got your markings on the floor if needs be. You've got your staff inducted. You've got your staff questionnaires filled up. You've got in place contact tracing, which will be the questionnaires for visitors coming in, etc. So you've got all that set up. Then it's a case of implementing it, putting it all in place, and then then it's up to the lead person who's in charge of the response plan to keep it up to date, to make sure it's working, to make sure all the cleaning is done properly. Roles and responsibilities will have to be assigned to people. So the plan, as you can see, like, it's in depth. It's the heart of it, and it's an important document. So you have a duty to have it. Now, look, we in Alcom, we do these plans, like, for all our clients, and we're doing it for quite a few people at the moment. If you'd like us to talk to you, where we might be able to help you in preparing one of these plans, we'd be delighted to do that. I'll have a contact button down below that you can click on, and we'd be delighted to speak to you about it. So I hope it was of benefit to you, and let's get back to work, and hopefully everything will be okay, and I'm sure it will be. So take care, and thanks. Bye-bye.